Myself, Dr. Manisha Deshpande, consultant physiotherapist from Nagpur. Today we shall be discussing regarding the knee pain. Now, knee pain, again, it is seen in the younger population, in the middle-aged population as well as the older population. In the young age, in small kids, many times it is because of the developmental problem, that is Osgood's disease we call. It is an inflammatory condition affecting the long bone of the leg. Then in the growing age, in the sports person, it can be because of the ligament injury, meniscus injury, or because of any injury, trauma. We call it as a trauma. And once you cross 40s, 45, then the knee pain, it is usually of a degenerative kind, which is called as the osteoarthritis. So for all these three different types of the knee pain which are seen across the different age group, the treatment varies. In the small children, when there is a Osgood's disease, there are small microfractures at the tibial bone. So in this case, you have to give rest to the patient and good supply of calcium, and later on the patient can be given physiotherapy exercises, which includes quadriceps strength building exercises and the core strengthening exercises. When the patient comes to you because of the instability, that is the ligament injury or a meniscus injury, which are often seen in the players, football players, badminton players, or it can seen to any sedentary lifestyle person also because of some injury, twisting or turning of the knee at a wrong position. So if this happens, then first line of treatment will be to decrease the inflammation. The knee is often swollen. In that case, we have to give the ice fomentation, as well as patient is advised to go for a MRI, and the MRI will show you the extent of lesion, which decides whether it needs operation or it can be managed conservatively. If it is conservatively managed, then there is a set of exercises and the physiotherapy modalities which helps in decreasing the inflammation and swelling and pain around the knee joint. And then we start doing exercises which are in the form of static quadriceps exercises, strength training for the hip muscles, hamstring muscles, quadriceps muscles, then the postural training and the core muscle building, because whenever there is a peripheral injury, the core muscles also they are inhibited. So it is our prime focus that we have to increase the strength of the core muscles. Then we have to increase the proprioception, or we have to relearn the patient, make the patient relearn about the proprioception and give strengthening exercises to the joints, which I have already mentioned, and special focus is given to the quadriceps muscle and the hamstring muscles. Then the older group which are having the osteoarthritis of the knee joint. These patients in the late stage are often seen with deformities. Either it is a bowing of their legs or it can be the knocking of their legs. So you do not have to just address the knee joint. You have to see the overall posture of the patient, and you will find that many of these patients, they do have the flat arches of their feet. So if that is the case, it is this flattening has happened secondary to the deformity in the knee joint. So if you correct the arches at the right time, the knee pain is decreased. So proper footwear correction is very important, and along with that, to increase the range of motion, because of the osteoarthritis, often there is a decrease in the range of motion at the knee joint. So the aim of physiotherapy will be to reduce the pain, to increase the range of motion, and to build up the quadriceps and the hamstring exercises, to do the footwear corrections and give the core strengthening exercises. If these things are done regularly along with the weight control, that is very, very important, because obesity is one of the foremost cause for getting the osteoarthritis in the knee joint. So obesity you have to avoid, you have to keep moving and do regular exercises in any form, have a proper good square meal every day. So if you follow this discipline, the knee pain can be avoided. Thank you.
Ma'am, one small question. If the patient is suffering from diabetes, or sugar, does it have a more serious effect on this?
See, that systemic illnesses, they will affect the knee joint definitely. It's a very good question. If the patient is having diabetes, it is not just affecting the knee joint. Many times that pain is not because of the diabetes, but the diabetes patient often develop the neuropathy. So the nerves around the legs or the hands, they are affected because of the diabetes and they get the pain. So knee pain, which is of osteoarthritis origin, and along with that the neuropathic pain, then the patient gets unbearable pain. We will be discussing the pain in the shoulder and frozen shoulder. Now, why one gets a pain in the shoulder? So this pain in the shoulder can be because of the disc prolapse in the cervical region.
Oh.
So all shoulder pain cannot be you cannot term it as a frozen shoulder. You have to first isolate what is the cause of this shoulder pain. So it can be a radicular pain because of the prolapsed disc in the cervical region. It can be because of the injury in the shoulder which is seen in the sports person or the person who are doing repetitive kind of work in the same manner. So this leads to the degeneration of the rotator cuff, or it can be a injury or a traumatic injury to the rotator cuff, which is a chief group of muscles, 4 muscles which supports the shoulder joint. So radiculopathy, rotator cuff injury, then it can be a degenerative or infective focus, often the TB of the shoulder joint. Then it can be a frozen shoulder, which is commonly seen, which is called as adhesive capsulitis, frozen shoulder, or periarthritis of the shoulder joint. So if it is a instability because of the rotator cuff injury, the set of exercises will be different. Then here we are focusing more on the strengthening of the rotator cuff and decrease of the inflammation in the rotator cuff. If it is a frozen shoulder, what can be the reasons for the frozen shoulder? Most common reason is the diabetes. If the sugar level is not controlled, then the patient often present themselves with the symptoms of frozen shoulder. Then frozen shoulder is often idiopathic. What do you mean by idiopathic? That is without having any reason. Sometimes there is a calcified tendons or the calcium deposits in the shoulder capsule which is seen in the aged people. So that is also one of the cause for getting the frozen shoulder. And frozen shoulder is often associated with extreme pain during night time. When the patient relaxes, that time the pain triggers. And once he starts moving around, the pain decreases. So and the frozen shoulder is seen in the 3 phases. So in the early phase, if you take address of this condition, then it is recovered early. Otherwise, if you go by the physiological means, it often takes more than 6 months to recover from the frozen shoulder. So the treatment of the frozen shoulder includes, first is and foremost is the reduction of the pain. Again, there are various physiotherapy modalities which the physiotherapist assess and then decides what is good for the patient. And once the pain is decreased, simultaneously the exercises are started, which includes the mobility exercises, where some passive stretches are given by the physiotherapist, some active exercises are taught to the patient which can be done easily at home. Then active capsular stretches, passive capsular stretches are given, pendulum exercises, Codman's exercises, and different mobility exercises are given. Then once some range is achieved, then strengthening exercises are taught to the patient so that the range which is gained has to be maintained by doing the strength training. And again I am repeating that whatever is the cause in the peripheral joint, you have to always address the core muscles. These core muscles include the muscles of the abdomen, muscles of the back. So along with the shoulder exercises, you have to do the cervical exercises as well as the core muscle exercises to get rid of the shoulder pain. Thank you.
Ma'am, shoulder pain often results to frozen shoulder. So how can we avoid this? If there is a pain in the shoulder, what apart from the treatment you told, what care a patient should take that it doesn't get worsen or goes to frozen shoulder?
Yes, it is happens because there is a pain, patient avoids the movement. Once if the movements are avoided, the frozen shoulder will happen. So whenever there is a pain, so you have to address the pain. If the pain is less, then the patient can move the shoulder joint. But as I told, if there is some muscle injury, in this case, because of the movement, again the extent of the injury may increase. So proper diagnosis is very important. I always tell the patient that just don't go by all the things which are seen on the social media. You have to first take a proper consultation. That is very important. Otherwise, just by looking into the social media advices, and if you start treating yourself on your own, then many times it will do more harm rather than some help.
Thank you very much, madam. Thank you very much for your guidance and all the things that you have told. Thanks again.
Okay.